Hey there, healthcare professionals! Today, I'm diving into the life-saving world of extracorporeal membrane oxygenation, or ECMO. ECMO is a critical care technique used for patients dealing with severe cardiac and respiratory failure. Think of it as an artificial heart and lung taking over when these vital organs need a break or are unable to function on their own. Let's break down the types of ECMO. First, we have veno-arterial, or VA ECMO. This type supports both the heart and lungs. It diverts blood from a vein, oxygenates it, and pumps it back into an artery. For instance, a patient with severe myocarditis leading to heart failure might be placed on VA ECMO to give their heart a chance to rest and recover. Next, there's veno-venous, or VV ECMO. VV ECMO is for patients with severe respiratory failure but whose hearts are still functioning well. It supports only the lungs by oxygenating blood from a vein and returning it to a vein. Imagine a patient with severe ARDS due to pneumonia. They might be put on VV ECMO to allow their lungs to heal while maintaining adequate oxygenation. Now let's talk about when ECMO is indicated. It's typically used for severe respiratory failure such as RDs, pneumonia, or trauma. It's also used for severe cardiac failure like myocarditis or cardiogenic shock. Additionally, ECMO can serve as a bridge to transplant for patients awaiting a lung or heart transplant and in some cases of prolonged cardiac arrest known as ECPR. So, how does the ECMO procedure work? First up is cannulation. For VA ECMO, cannulas are placed in a large vein and a large artery. For VV ECMO, cannulas are placed in large veins, typically the femoral and internal jugular veins. Then, there's the circuit process. Blood is drained from the patient through the cannula, passes through an oxygenator where it gets oxygenated and has carbon dioxide removed, and then the oxygenated blood is returned to the patient's body through another cannula. Monitoring and management are key. Continuous monitoring of vital signs, blood gases, and anticoagulation levels is crucial to prevent clotting in the circuit. Adjustments to ECMO settings are made to ensure optimal oxygen delivery and CO2 removal. Let's look at a couple of examples of ECMO in action. A 35-year-old with severe ARDS due to influenza wasn't responding to conventional mechanical ventilation. Placing them on VV ECMO allowed their lungs to rest and recover while still ensuring adequate oxygenation and CO2 removal. Another example is a 50-year-old patient who developed severe cardiogenic shock post-coronary artery bypass graft surgery. Placing them on VA ECMO provided necessary circulatory support, allowing the heart to recover from surgical stress. ECMO is indeed a complex and resource-intensive therapy. It requires a multidisciplinary team approach, including critical care physicians, surgeons, perfusionists, and specialized nursing staff. Often used as a last resort, ECMO is a testament to the advancements in medical technology, offering hope when all other treatments have failed. Thanks for tuning in, and if you found this video helpful, don't forget to like and subscribe for more medical insights.